Hello, everybody. Welcome back to the podcast. We are joined. That's fine, Daphna. That's fine.
So noisy.
Ravi Patel is with us. Ravi, how's it going?
It's great. It's great to see you guys here.
Likewise.
This is a great meeting to be at.
That's right. That's right. It's a very inspirational meeting and expertly crafted by Jen Canvasser and the rest of the NEC Society.
Yeah, she's amazing, and so is the NEC Society.
That's right.
Yeah, well, you are a big part of the NEC Society. Just in terms of this conference, we know yesterday you were the moderator for the session, The Medical Management of NEC. What should we have learned about the medical management of NEC?
Yeah, it was a great session. There was, it started with Maz, who gives a wonderful story about Freddie, her son, and talks about the experiences of going through the diagnosis of NEC and the challenges of long-term consequences of NEC. And then, Jenny, Quinn, Toby Yenowitz, and Irfan Ahmed all talked about kind of the opportunities there are when there's uncertainty. So we really don't have a lot of good data on how long we should treat babies with NEC with antibiotics. When should we restart feeding? Those types of questions where there's a lot of uncertainty. Maybe there's opportunities for quality improvement to at least standardize and reduce variability in care. And so I think those are two areas of, can we shorten or alter the duration of antibiotic therapy? What are the choices? When can we restart feeding? And some of the evidence and uncertainty in that area. So that was a big theme.
Questions that plague us every single day.
Yeah.
Every day.
Yeah.
Yeah. So, and I think it's tough. The Irfan showed some of the trials. It's been, in the 1980s for antibiotic choice. And so we haven't had anything for decades. And yet we have to make decisions every day. How do you go forward? I think you want more evidence, and that's always an impetus. But the other part of it is, there are these other tools, which is even when there's uncertainty, at least standardizing and reducing variability is important. I think our patient families say, that clinicians change week to week. Everybody does something different. Maybe there's a value just in trying to get consensus and standardized care.
That's right.
Totally agree.
We were just talking about that.
Yeah. And today you are going to be part of the session on the microbiome, probiotics, and the prevention of NEC. What are the take-home points?
Well, probiotics are a topic near and dear to my heart and hot topic. I would say the first take-home point is check out the probiotic toolkit that the NEC Society has developed. They just highlighted it's been downloaded over 1,000 times. And I think it's useful in two regards. One is to make intentional your perspective and your center's choice on whether or not to use probiotics, which I think it's not advocating for that, but to go through that first part. And then for centers that might be interested in it, to really then look at some of the nuances and considerations. My talk is going to be focused on the evidence and the practice use, and we have seen increases in use. There's a nice poster yesterday where it went from about 14% of U.S. NICUs to now about a third of NICUs are using probiotics, and kind of when you think about the evidence, sometimes we're thinking of just the next and most recent study, but there really is this broad body of literature from the animal models and the work that people have done in the lab to some of the clinical trials to a lot of data now we have on the experience of what's happened when centers use probiotics and what do they see. And I think when you really to consider the totality of that evidence as you make decisions about use and which products to use, that's kind of the big take home.
Okay.
Do you think, going back to the discussion about the duration of antibiotics, and we were talking to Susan Hintz this morning about how surgical NEC has really terrible neurodevelopmental outcomes, balancing both the antibiotic stewardship, but also the fact that we want to avoid surgical NEC at all costs. Where do you think we'll land in terms of more antibiotics to treat medical NEC or less antibiotics, and maybe, I don't know, which, and I think both approaches are equally risky. So
yeah, it's hard. I think about, how could you do a trial? And if you did that, you would probably have these babies who are relatively well, where the clinicians are probably okay with just doing a short course. And then you have the babies who are really sick and are not doing well. And you're probably going to be really hard to get clinicians to stop using antibiotics. And those are the patients that are going to get prolonged, treatment. And then there's this middle group where I think there's maybe some equipoise. So I think it's a hard question. I do believe fundamentally that the outcomes we are working on a study in the NEC Research Network now, looking at kind of an update on long-term outcomes, and some more to come on that. Hopefully, we'll be able to be presented next year. And the kind of first look is it's very sobering. And if we're up against that for surgical NEC, really prevention has to be the kind of key predominant strategy. And I do think there's opportunities that are not being used to prevent NEC. That is, once you develop it, once inflammation sets in, once you have the surgery and all the things that go along with that, I think mitigating the consequences of that are important, but I think that those effects are going to be, we don't really know how effective we can be in reducing that, but I do think we know that we can do things to prevent NEC today.
And to that point, you've been very involved with the NEC Society. So tell us a little bit about your involvement with the NEC Society. And we're asking everybody the question Jen posed, what is your why?
I've had the good fortune. The first NEC symposium I came to was in 2017. That's around when I got involved with the NEC Society. And it was just such a different experience. Really, the power that working and partnering with patient families has, and the voices they bring, and the motivation, and sometimes the heartbreak that they bring is really, I think, motivating and powerful. And that's been, that's when I started working. So it's been, 6 years of wonderful work and seeing the organization grow. And I think we have now really finished up an effort in terms of finding research priorities and hopefully moving those to actually kind of taking on projects, but also moving the needle on clinical care, advocacy, other aspects of the care of infants with NEC. And that's partly the why, I think, is this is such a devastating disease, and I think there's just this imperative and need to really think about how we can better understand it to prevent it, and then not only understand it, but actually work to translate that evidence into practice, because I do think that is part of the story, is not just generating the evidence, but actually making sure that it reaches patients, and these meetings are incredibly useful for that.
Ravi, thank you for dropping by.
Yeah, thank you. I'm glad to see you here. You all are doing amazing work. So
Thank you.
It's always
Thank you
good
so
to see
much.
Okay.
Yeah.